Hi guys, welcome to our Facebook Live. I'm Julie, the digital beauty editor for New Beauty Magazine, and I'm here on the Upper East Side of Manhattan with Dr. Z. Paul Lorenc. He's a plastic surgeon on the Upper East Side, and we are going to demonstrate something super exciting. It's called the Silhouette InstaLift, and it is a procedure that lifts and raises the patient's face. We're going to get into all the specifics. But anyway, before we even demonstrate that, tell us a little bit about what this procedure is and who it's good for.
So Silhouette is a suture that has little cones on it. As you can see, it's made out of completely absorbable material. Polylactic acid and polyol glycolic acid. It's sort of like Sculptra. And once I place it in underneath the skin, what it does, by placing it underneath the skin, what it does, it lifts the skin and the fat pads. But it also does something very interesting, that as it's being degraded, as your body is processing it, it creates volume. Because it's just like Sculptra. Again, polylactic acid stimulates your body to produce collagen. And the coolest thing is at 5 to 6 months, you have this beautiful change in the quality of the skin, radiant skin, volume formation, and so the patients really get more than just a lift. They also get this volume formation and a great change in the quality of the skin.
That's amazing. Now, who does this work for?
Well, it works for anybody, but an ideal candidate is exactly our patient today, Stacy, who is barely over 18, I think, right? but mostly, it's still mostly women, 91% in our practices, according to our statistics. But it's women in their 40s, mid-40s, early 50s, where really the beginning of the jowling starts, pronounced nasolabial folds, a little bit of laxity in the neck, and you can really correct that with Silhouette InstaLift, both because of its lifting capacity and also because as we age, you know, we lose the volume in the face, in the temple mid-face. And this particular product, Silhouette, can increase the volume by stimulating collagen. So those are ideal patients, but I have used it in a very broad spectrum of patients, all the way from 29 to 86 years of age.
So it's good for a lot of different types of people.
Absolutely.
Now, a little bit of background on Stacy here. She is 52 years old, and she has done things like fillers before, but no big surgery. She's never had a facelift or anything. And she just wanted something that wasn't necessarily a facelift, nothing that was too invasive. She wanted something that was in between fillers and in between that facelift in order to get that rejuvenated look. So we're going to let you get right into it.
All right. Thank you, Julie. Just turn your head a little bit. That's it. Okay.
So what's the first step of the procedure?
So what we did is we prepped the face. Of course, this is a sterile procedure, and it should be treated as such. What I did is I also marked the entrance points, which are right here. We're placing 6 sutures on this side and 6 sutures on the other side, and then the exit points you can see. Everything has been numbed up with a local anesthetic, and the first step is really just making the entrance for the suture. So what I use is a specific needle. The suture, as you can see, it has these little cones on it with knots in between to hold it in place. And the first step that I do is just to tie down the knots so they don't slide anymore.
And how is this different from like thread lifts of the past?
Well, it's very different because what this is, so this is a completely absorbable material. Contour threads, if you're referring to, were permanent and they were placed in the dermis, in the skin. Very different. They would erode, possibly erode through the skin. Permanent suture. This is very different, totally absorbable. And you can see I'm placing it really in the subcutaneous tissue. I'm gliding it. I'm gliding it just like a cannula. When we do fillers, it's basically like using it as a cannula. And you can see that it just comes right out where I marked it before. And then the cones just sort of disappear underneath. Carrie, can you cut for me, please?
So is that one suture finished?
That's
there?
Half a suture.
Half
so
a suture,
the
got
cones are sitting right now this way, facing up, and the cones on the upper portion are facing down. These cones will be used as an anchor, and then everything will be advanced towards these cones.
Amazing. And now what kind of candidate is not someone who you would recommend try this?
Well, you know, someone who has very thick skin that does not move, someone who, a man who has, for instance, usually male patients, with very, very thick skin, that's more difficult to advance the tissue. Or someone who has very, very thin skin, on the other hand, also can be difficult to advance the tissue. And But I've done it in both cases. You know, it's really about the placement, and that's it. Once suture is down, you can see what I do is I make sure that there's absolutely no indentation, and Carrie's just going to cut my suture, and we're ready for the second suture. And we just progress. We're doing 2 here, and 2 in the neck.
So 6 in total on each side. Do you normally do 6, or does it vary patient to patient?
It varies. It really is dependent. You can see that the little knots are not tied completely, and what I do is the first step is just tighten the knots. I think this is a very cool procedure because, as you can see, patient is extremely comfortable. I'm not hurting you, am I?
No, not at all.
And now, why would someone choose this over skin tightening procedures?
Well, it does 2 different things. You know, skin tightening, and I do combine skin tightening. For instance, Thermi, I love ThermiTight, which is a radiofrequency device that does do skin tightening. This is more of a lifting procedure and a volumizing procedure, more so than a skin tightening procedure. Go ahead.
How long does it typically last?
About 1.5 years. It varies from patient to patient, but typically we see the effect lasts for 1.5 years.
And are there any adverse effects or downtime? I know a lot of patients get nervous that with a facelift, the downtime is extremely long. Is there any downtime with this?
Well, maybe about 2 days. You know, patients can get a little bit of swelling, usually not very pronounced, but it can happen. So I typically tell patients that it's about 2 days of downtime. If you do it on a Friday, like we're doing it today, cut please, you'll be absolutely fine to resume full activity on Monday.
And are there any adverse effects, or is it generally a safe procedure?
It's a very safe procedure. Like in any procedure, there's a chance of, when you break the skin, there's a chance of infection, but that's just so unlikely. I've done hundreds of these, and I have not seen that yet. The incidence from that, so this is the product was brought to the U.S. 2 years ago, and the European data on the safety profile is extremely good. 500,000 of sutures implanted, and very rare incidence of infection or bruising. So it's truly a very, very safe procedure.
Now, a lot of people are tuning in and they have a bunch of questions already.
Okay.
They want to know what's the general cost and how it differs from doctor to doctor.
Well, the cost is very different from doctor to doctor and also from region to region, please. So I'm in New York City, New York, a city so nice, they named it twice, as I like to say, right on Park Avenue. So yes, we do charge a fair amount. I think it's a little bit different than some of the other places, but it varies from $3,500 to $6,500.
Got it. And now people want you to explain again what you're doing. So with the needle, with the one that you put in first, that's a cannula, correct?
The first needle is an 18-gauge needle that introduces or makes a hole.
Got it.
Through which I put the 23-gauge needle, which you see right here. And I think in terms of gliding underneath the skin in the fatty tissue, in the subcutaneous tissue, like a cannula. It's not a cannula, it's a needle. As you can see, it comes out through the skin. But it's not again, it's not a cannula because it doesn't, it's not blunt, it's sharp.
Got it.
Cut, please. And we're just moving along. We are on number 4, I think, at this point.
And now once it goes in, and then the thread is complete, those threads are pulling the skin up?
Sutures, yes.
The sutures, okay.
We will set that up. So I will do, after I complete placement of the sutures on the right side, I will show you how the tissue is advanced. Okay?
Got it. So right now it's just the placement of the threads.
Sutures.
Sutures. Yes. Okay, great. Now, everyone wants to know what is the biggest safety concern for this. I know you mentioned infection. Is there anything else?
No, I mean, infection, again, very, very rare. This is a placement above all the facial nerves, so it's very unlikely that you can have injury to the facial nerve. We have just not seen it. Anything theoretically is possible.
Right.
But you see how easily it just drops right in the cup, please. Cut. And overall, it's a very, very safe procedure. And as you can see, done under local, patient is comfortable.
And when can the patient start seeing results?
Well, they see results immediately. And that's the result of the lifting that this particular device provides. And then as time goes on, not only do you see the effect of the lifting, but you see effect of the volume creation and volumization of the face and quality of the skin changes. Cut, please.
Got it. Well, again, guys, for those of you who are just tuning in, we're here on the Upper East Side with Dr. Paul Lorenc in New York, and we are doing the Silhouette InstaLift, and it's a procedure that lifts the face, and it also, as the doctor explained, changes the quality of the skin a little bit as just an added bonus. Our patient here is Stacy. She is 52 years old, and she has only gotten fillers before, so this is her first lifting procedure. So again, Dr. Lorenc, if you could just explain what the Silhouette InstaLift is for the viewers.
So it's a bioabsorbable or completely absorbable device that has cones on each side, and the cones are oriented like this. We insert it into the middle of it, and then the cones are facing both ways. So what happens is these cones, the upper cones, act as an anchor, and I'll show you how I advance all of the tissue towards the anchor. So it lifts the tissue, completely absorbable device, minimally invasive, because as you can see, we're just doing it under local anesthesia. Patient's very comfortable, ambulatory obviously. Patients go home right away after the procedure.
And then can you explain the difference between this and a facelift?
Absolutely. Cut, please. So a facelift involves obviously an incision around the ear. There's no incision here. There's really no downtime. Just a couple of days of, chin up please, thank you, of swelling. So facelift is obviously much more extensive, much more invasive. Usually facelifts we do, and I do a lot of facelifts, but facelifts require anesthesia. And it's not general anesthesia, but twilight anesthesia, but still. So there's a little bit of more of a recovery, of course, closer to a week versus 2 days.
Right.
Because of the anesthesia.
So this is a recovery of only 2 days, whereas a facelift is a
About
much
a week.
longer recovery.
Yeah. And you know, there's more swelling, of course, with a facelift.
Right.
Facelifts are a great procedure, yet they address something different. You know, the interesting thing is that here we are using, or what happens is that you have this added benefit of volumization of the face, which I think is such an important part of what Silhouette does. Because as you know, as we age, not only do we have sagging of the skin and sliding sort of all of the fat compartments, but also what happens is that the quality of the skin changes.
Right.
And you lose the volume as well. You lose the fat compartments, the volume and the fat in the fat compartments. And this, in a very unique way, brings that back. So it really addresses aging on many different levels than just pulling the skin, which a facelift does, of course.
Got it. So Dina, one of our viewers, wants to know what happens after the sutures biodegrade.
Nothing, you go back to baseline.
So they just dissolve on themselves?
Totally dissolve, completely.
Amazing. Brenda wants to know if it's suitable for patients with thin skin.
Yes, you have to be very careful as far as the application, because as you can see, you don't want to see either the outline of the suture or the cones. So, but obviously, like anything else, it has to be properly done. If it's if it's properly done, it's fine. You just whoever is doing the procedure, obviously, the doctor has to make sure that they're deep enough that they don't you don't feel the cones or the suture.
And now, how often would a patient have to come get this redone?
Well, usually about 1.5 years. You know, it varies. I've been doing this for exactly 2 years right now, this month. I learned how to do this procedure in Paris. And it was a wonderful experience.
It's amazing.
And so the Europeans have a longer experience with this than we do. But we have, I think, caught up very quickly right here in the U.S.
Does this only lift the neck, or I mean, I know it does the cheeks as well, but is there any other parts of the face that this can lift?
Yeah, please.
Like the eye area?
Well, we've done brow lifts. Yes,
Okay.
we've done brow lifts. I have also done what's called an ectropion correction, where there's a pull down of the eyelid, and you can correct that by using Silhouette. So really, any redundant tissue or hanging tissue you can do. So I think just for the sake of time, what I'm going to do is show you how to sort of inset or advance the tissue. Okay?
Amazing.
So first we'll complete the first side, and then we'll do the other side. So I'm just setting the sutures first, and this will just take a couple of seconds just to make sure that everything is absolutely flat.
So you're just pressing against the sutures to make sure that they're
Make
against
sure that the
skin?
line is straight, exactly,
Got
that the cones are engaged. And then what I do is I advance the tissue. So in the nasolabial fold, for instance, you can see that what I'm going to be doing is I'm just going to hold on to the suture and then advance the tissue. And you can feel these little clicks, and look what happens to the tissue.
What exactly does advance the tissue mean?
Moving it forward, moving it up to where it used to be.
Got it, okay.
So see the fullness, or the malar fat pad, as we refer to, it's now repositioned, and the same thing I will do with the other suture. And Stacy's comfortable. I'm not hurting you, am I?
No.
So one of our viewers, Ellen, wants to know if it will pull up the area under the temples as well.
Under the temples, yes. We're going to be doing that in a second. But look what I'm doing right now. I'm just advancing the whole unit, just locking it. And you can see how the tissue has been advanced. And I just do this for every single suture that I've advanced. Now we're correcting the jowls. And what you can also see, and can I have a saline?
I can actually feel my skin tighter.
Yeah, exactly.
That's amazing.
You know, everybody
I can
says
feel
that.
it.
It's amazing.
It is amazing. I could feel like I'm already a good many years younger.
but it's true. Everybody says
I
that
can
when
feel
you do
it.
it. So what
Feels great, actually.
So what I'm doing right now is in the jowls, just advancing, and you can see I'm advancing to the point of insertion, and I think it's just the coolest, just eliminating the jowl. And you can see that there is redundancy of the skin. This takes about 2 days for everything to smooth out.
Wow. It's crazy that results are so instant.
Yeah. You know, I think the design of this particular device is simply brilliant. You know, it's simple and brilliant, which of course I love. So, and then the last set of sutures I will use in the neck. Now, this is approved by the FDA in the U.S. for mid-face elevation. So what my use in the neck is what's called an off-label use, which is of course allowed by the FDA. But you do have to have experience. So, and I also teach a lot of physicians how to use this device. But first, we make sure that everybody's very comfortable in using it in the mid-face before they advance to the neck.
Now, speaking of that, is this something that a derm and a plastic surgeon can do, or only a plastic surgeon?
No, dermatologists.
They can do it as well?
Facial plastics, absolutely. And what you just saw, I just locked it even more in place, and you can see the effect on the jowl.
Oh, wow.
Right? So now we're just going to do the neck. Again, holding on and advancing all of the tissue.
Heather, our viewer, wants you to repeat who would not be a good candidate for this.
Someone who has very, very thick skin that is not mobile, where I can't move the skin. I would probably not use this device. Now you can see how much skin I have moved. Or someone who has extremely thin skin where you would possibly see the cones through the skin. Now that's very rare. I've used this, I've used Silhouette on an 86-year-old patient who was not a surgical candidate because she had health issues, where she just would not tolerate anesthesia. And I did Silhouette in the neck and in the mid-face, and she got a fantastic result, even though she's very thin-skinned. But
Wow.
we were able to put it in the right plane, and she did great. But look at all the advancement of the tissue that I have.
Wow.
Let's just straighten it.
So are you ever too old or too young to get this procedure done?
I don't think so. I think it has to be assessed on an individual basis.
And Andrew wants to know what kind of maintenance is required once you go home and you're in the recovery process.
You have to take it easy for a good week. And I am very strict. My patients are very aware of the fact that I'm very strict with post-op instructions.
That's good.
You have to really be careful. For a week, you don't want to move your neck, because if you do this, you can disengage the cones, or a lot of chewing or a lot of talking. So we have very specific instructions that Carrie whips the patients into understanding. And anyway, so for a week, you have to take it easy. At 1 week, full activity.
Got it. And does the patient have to wait until the sutures are completely dissolved before having it redone?
Not necessarily, no.
Interesting.
No, but typically I see patients, I'm already seeing that first round of repeat patients, because I've been doing this for 2 years. The average is 1.5 years.
Got it.
Okay, so we are finished with the first side, and you okay?
Yeah, it feels, my skin feels amazing. Amazing.
It will feel
That's so exciting.
and
It feels like you just had the best facial, and your skin feels like taut, but smooth in a way, I guess.
perfect.
Wow.
And no pain. No pain.
Excellent. Just turn your head to the side, please, a little bit more.
And can the sutures be removed if something goes wrong or if the result isn't what they're looking for?
Sutures can be removed, yes. The answer is yes, but I have to say that so far, suture please, I have not had to do that.
No one's wanted that, yeah.
And hundreds of patients. So anything is possible. You know, we always qualify in surgery or in aesthetic procedures. We always qualify that. Of course, anything can happen, but this has such a great safety profile, this product.
Amy wants to know if this could cause scar tissue under the skin.
Well, it causes collagen under the skin. Now, the difference between scar tissue and really forming collagen is there are different types. There are 5 different types of collagen. This causes type collagen, type 1, to be produced, which is the good collagen.
Got it. Amy, so we already asked Amy's question. So a lot of people are actually asking, once you're done with this suture, if they could just see her face side by side.
Yeah.
And also if you could just quickly recap what the Silhouette InstaLift does for your patients, because we have a lot of new viewers tuning in.
Okay, let me just finish putting this suture in, and then I'll answer all of those questions.
Perfect. And again, guys, we're here on the Upper East Side with Dr. Z. Paul Lorenc, and we are showing off the Silhouette InstaLift. And again, our patient is Stacy. She's 52 years old. She's never had any surgical procedures before. She has only done fillers, so nothing invasive, just those, fillers, regular type of things, nothing surgical.
So what Silhouette does, Silhouette is a, let me have a suture so I can just show while we're talking about it.
Okay.
So Silhouette InstaLift is a product approved by the FDA for use in lifting the midface. And it has these, you see these little cones made out of polyl-lactic acid and polyl-glycolic acid, and they are on a particular suture that comes with 2 needles. And these knots, as I'm tightening the knots right now, keep the cones from slipping. So what I do to the insertion point, go one way and then the other way with the needle. So imagine that the suture is being placed like this. You can see that the cones, this is called a bidirectional product or suture, because the cones are directed in 2 directions, bidirectional. And what the cones above are used for basically is the anchoring cones, because this tissue is less mobile, this tissue is mobile. So if you have a difference in mobility of the tissue, this is used as an anchor, and as you saw on the other side, by holding the suture, I'm advancing all of the tissue on the suture, and getting a lift. But also the other very cool thing about this particular product, Silhouette InstaLift, is that this is not only a lifting suture, this is also a volumizing suture. Because all of this material, the suture and the cones themselves, are completely bioabsorbable. So your body just, as it processes it, it stimulates collagen type 1, which is a good collagen. So you volumize the face, you have changes in the quality of the skin looks radiant, the pores get smaller. Okay,
Amazing.
so that's how it works.
So before you go into the next suture, maybe if we could just show a before and after of the one side. I know we did one suture on the other side, but the other side is completely done.
Straight and just gently, okay. See if you can appreciate, but you can see all of the tissue from here has been moved up to here. The jowl has disappeared, and all of the skin from the midline, you see how it's bunched up towards the side. Now this settles down usually about 2-3 days, and more. That's it. And you can see the effect that I've created right here just by pulling on the
That's
suture.
amazing.
And
especially in the neck and the cheek.
yeah, and you know the amazing thing is that we have done it through tiny little puncture.
Yeah.
Without any incisions.
It completely changes the look of the face.
Yep.
That's amazing. Okay, so let's keep going for the next suture. So we have some more questions. Andrew wants to know if it can be done on any other part of the body or just the face.
Well, so far we've been using it in the face. The question is, can it be done in the arms? Can it be done in the butt? You know, and all of those questions, we have those questions all the time.
Mm-hmm.
We have really very limited experience with using it in the body. And the question is whether the holding force will withstand the movement of that part of the body. I don't quite know yet. We don't know yet. That's the real answer. But that's probably going to be the next step with developing new suture applications.
Okay. Susan wants to know if it can cause skin discoloration.
Haven't seen that yet. And the reason for that is that it's a deep placement.
Mm-hmm.
So it's not a superficial placement. Like the old contour threads, which was a more superficial placement, this is a deep placement. That's why a lot of things that can happen with superficial placement just do not happen. And you can see that I'm right in that malar fat pad in the fatty compartment.
Got it. Letitia wants to know if it's a partial lift or a full when you do this on patients.
Well, it's very different than a facelift. So this is not a facelift. You can encompass the whole face. Mm-hmm. I can do it in the brow, I can do it in the mid-face, I can do it in the neck, as you can see, and the jowls. Just turn your head a little bit more.
Now from Nicola, she is curious as to whether or not you have to come in for touch-ups within that 1.5 year span that they are.
No, usually
No?
not.
Okay.
But you know, it's not infrequent that I combine this procedure with whether it's thermi tight, thermi smooth, fillers, neurotoxins, Botox, Xeomin, Altera. So you can do all of these modalities in combination with this procedure. So this is not usually, it's not a standalone procedure. It's usually a combination of procedures that we use.
And do you do that all on the same day?
Usually not. I like to wait about 6 weeks.
Okay.
Go ahead. Before I administer what we call energy-based devices.
And can you see the cones under the skin when it's finished? No?
No, they completely disappear. And when I'm finished, you can't see the cones right now.
No.
No.
Mm-mm. Yeah, me standing here, I can't see anything other than what's left outside the skin, but obviously you cut that out after. So
Yes.
Tatiana also wants to know how long it takes for the sutures to dissolve in total.
Probably about 16 months, 16 to 18 months.
Mm-hmm. And can you just recap again how it leaves behind better collagen production?
So it makes type 1 collagen. As we get older, we lose that. So type 1 collagen is the young collagen, is the more pliable collagen. It's a better collagen.
So again, for guys that are just tuning in right now, this is called the Silhouette InstaLift, and it is a procedure that lifts the skin it is similar to a facelift, but without any of the downtime. You're not pulling the skin up. You're not in surgery. The patient is awake. They've just been numbed. And it also helps build collagen underneath the skin and just lift up any sagginess. So before we wrap it up, can you just say once again, what this is and who this is good for?
So this is Silhouette InstaLift, made out of totally absorbable material, both the suture and the cones. It's great for patients in their 30s, 40s, 50s, really very broad range, minimally invasive, very limited downtime, maybe 2 days at all. And patients can resume full activity at 1 week, including exercise. Obviously a painless procedure. Lifts the skin, lifts the fat, volumizes the face, increases the volume, and changes and improves the quality of the skin. We love it, and obviously my patients love it as well.
Okay, guys, thanks again for joining in. If you have any more questions for Dr. Lorenc, please put them in the comment section and we will answer them afterwards. Thanks, guys.